of you?
Yes, ma'am, it's visible.
Okay.
Can you scroll that?
But it's, I think, not a PowerPoint presentation. That's why it's not shifting to the slideshow.
Okay.
Okay, so
Dr.
now I'm
Sarah,
starting. Yes.
you can still make it fully visible.
Well, I can't. Okay.
Try a few things. You can. Now I think you can.
No, it's two
No.
slides showing at the time.
Okay.
It's not running in PowerPoint. It's some Nitro
I
software.
think it's in PDF. It's in PDF. But next task, I will share you the PPTs. Okay, so it will be more comfortable. But OHSS we will start with PDF.
Okay, that is fine.
Okay, so Pooja, there are multiple slides which you have to see for this task.
You will
Okay.
let me know once you are done with this slide. I will be changing the slide for you. Other than that, now I'm starting the 2-minute timer for
Okay.
you.
Okay.
Ma'am, you can put it on single slide on the second last icon. If you click that, I think it will be in single slide.
What?
Yeah, this one.
Scroll up. Yeah, can you scroll up? Scroll up.
No, this is, I think, this one is the last slide.
Yeah, I'm ready to start it.
The first slide?
Actually, I'm ready to start.
Still, you have left 30 seconds.
Okay.
Okay, let's start it.
Okay. Hello, I'm Dr. Pooja. I'm ST5 in emergency department today. May I know your name and age, please?
Yes, this is Hala and I'm 31-year-old.
Okay, and how may I address you?
Hala is fine, doctor.
Okay, Hala. I can see that you have a lot of tummy pain, and you have recently undergone IVF and the collection at fertility clinic, and you are feeling generally unwell. Can you tell me more about your symptoms?
Well, it's basically the pain in the tummy, and it's a dull pain in the whole tummy. And other than that, I'm also feeling that my pants are getting a bit tighter. And
Okay.
yes, and along with that, I was also having like a bit of vomits and all that. Yes.
All right, Hannah, I'm so sorry to hear about this. But I can reassure you that we are here to look after you. And for the next few minutes, I'm going to talk more about your clinical background, ask few questions regarding your IVF treatment, and we can together make mutually agreeable management plan. Is that okay with you?
Yes, it's fine.
Uh, okay, Hala. So, you mentioned regarding pain. Can you score your pain from 1 to 10? How severe is it?
Well, it's like maybe 4 or maybe 10, 5 out of 10. Yes.
Okay. Okay. Do you want me to give you any painkiller as of now?
Well, the nurse who is working here in the emergency, she has already given me ibuprofen, and now I'm feeling much better.
Okay, that's good to know. Uh, Other than that, are you feeling any sickness? Have you thrown up from morning?
Yes, I did. I twice I did throw up.
Okay.
Along
Um,
with that, I'm also feeling sick, like nausea and all that.
okay. Are you feeling any tightening in your chest, any chest pain, or any breathing difficulties?
No,
Okay. Are you feeling any swelling over in your leg or back of your leg?
no,
Okay. Are you having any trouble while passing your urine or any bowel disturbances?
no. It does not hurt when I pass urine.
Okay. Uh, I just want to ask you regarding your general condition. Can you tell me when your first day of your last period?
I think it's a few weeks ago.
Okay. And did you have any pregnancies before?
No, no,
Okay. Do you have any general medical condition for which you are taking medications for?
no,
Okay. Any surgeries in past?
no.
Any kind of drug allergies at all?
No,
Okay. Any significant family history or
mm,
blood clots from?
no,
Okay. But have you ever been diagnosed with polycystic ovarian syndrome?
no.
Okay. How's the support at home?
Well, I'm living with my partner, and he is supportive.
Okay. Uh, right. So, I can see that you have been already assessed by our consultant. I would just like to check your vitals, like your pulse, blood pressure, respiratory rate, and heart rate. Is that what's okay with you?
Yes.
Okay. All right. I can see that you have been already advised for the blood investigation as well as the ultrasound. The details are there, and I have checked your name and NHS number, and I'm going to explain the results to you. Is that okay?
Okay.
So your blood investigation looks normal, and your ultrasound report suggests that both the ovaries are quite enlarged, and which is quite common after a collection in active cycle. Okay. And
Okay.
regarding the size of the ovaries and the other condition, along with your symptoms, I can tell that this is a syndrome called OHSS, which is ovarian hyperstimulation syndrome. Have you heard about this syndrome before?
Yes. The doctor who is helping me to have this test tube baby, he told me that I may develop like this complication, like it's one of the complication, and if I develop the pain in the tummy and all that, I needed to go to the hospital immediately.
Yes. So this is OHSS, and it is quite common after IVF cycle, and especially when you have multiple number of the follicles inside your ovary. So these symptoms develop after giving injection of the stimulation in your IVF cycle, where more of the follicles are developing, and these follicles and the blood vessels around it will secrete some fluid into your tummy, and sometimes in severe cases outside your lung as well. So these are the explanation of the symptoms, that why are you feeling pain in your tummy and from the nausea. So, according to your symptoms as well as the blood investigation and ultrasound investigation, I can categorize you as a moderate OHSS. I would like you to offer the admission for the better management of your condition. Are you with that?
Yes.
Okay. Following your admission to the hospital, we are going to refer you. We are going to discuss your case with a consultant, specialist nurse, hematologist, and involved fluid intensivist to take better care of your symptoms. Once your symptoms are quite controlled and when we feel it's not activating, we can safely discharge you. Meanwhile, while you are in the clinic, we are going to offer you some blood thinner injections because OHSS it is a very high risk of developing venous thromboembolism and the blood clots. So to prevent that, we are going to give you these injections. Along with that, we can safely give you paracetamol painkillers. Please do not take any other medications without asking us. Do you have any questions in between?
Yes, I really want to know that. Will you be going to admit me?
Okay, so we are going to admit you in the emergency department, and then we can shift to the gynecology department. So right now, your condition is not very severe, so we don't generally advise the ICU admission. We'll keep you under monitoring, and if your symptoms worsens, or if there is any chest pain or any breathlessness, we might offer you the ICU admission as well.
Okay, and I will be continue to take these blood thinning injections that you just mentioned me at home. Will you people guide me how to take these injections?
Yes, of course. Farah. So once your symptoms are quite controlled, we will advise for a discharge, but we will keep regular follow-up. You will have to come in the clinic for a follow-up every 2 to 3 days. We'll keep advising you to continue with this blood thinner injections for at least 7 days. We'll observe your condition and see if you need more or not. I will also write back to your fertility clinic who has done the IVF for you for the follow-ups.
Okay,
And
and I was also due to have my embryo transfer in, I think, 2-3 days. So would I be able to have my embryos, because I'm really anxious regarding the pregnancy and all that?
yeah, so in that case, when you have OHSS, we don't advise to go ahead with a fresh embryo transfer because this fresh embryo transfer can lead to increase in the severity of OHSS until late OHSS. So we'll inform your fertility clinic, and they will freeze your embryos, and rest assured that the frozen embryo transfer has comparable success rate with the fresh embryo transfer. So your embryos will be safe with them. First, we need to focus on your general well-being, your health at utmost priority.
Okay,
And
okay.
do you have any questions?
No.
So I'm going to give you some patient information to flip for you to read to have more information about it. And I will arrange your admission, and I will inform the specialist nurse to take this forward. Okay, so I just hope for a speedy recovery for you. Thank you.
Okay. Thank you so much for your time, doctor. Thank you. Okay. To start with the feedback, the total time that you use for this patient is almost 10 minutes and 30 seconds. The time management was good. You have done it very well, but there are only few things that I would like to add in it. In the
Okay.
feedback, what I would like to give is in the history, the pain you did ask me to score the pain. The vomiting you did ask me. Other than that, you did ask me, do I have any trouble with the urine? I told you I am not feeling any pain or any problem with the urine. The
I did
question
ask for,
that, sorry, what you were saying, sorry, I couldn't hear you.
yeah, so I did ask for the urine, difficult, like any urine problem or the.
Yes. In fact, with the OHSS, you needed to ask the patient that how much urine you are passing and have you changed any, have you noticed any change in the color of the urine?
Okay.
Because obviously, if the patient is dehydrated, then she will be passing less urine and the color would be darker. Other than that, from the history, the chest pain was there, the leg pain was there, the family history of clots was there. And yes, you can also inquire her one thing that can you frequently come for the follow-up? Because obviously, if you are sending her home, if you needed to send her home for the outdoor department management, then you will be following her after every few days, after every 1 to 2 days. Regarding
Yeah.
the explanation of investigation, that was fine. Okay. Somewhere, what I can say is that you could have also involved her that can you tell me more about that why you are undergoing the IVF process and how many eggs they have harvested to involve the role player.
Okay.
The IVF questions can be asked from the role player. Okay. Other than that, regarding the fertility clinic, yes, you can also ask that whether you have informed your fertility specialist before coming here that you are going through this complication and all that. That is another question that could be asked from the patient. This is all about the history. Regarding the explanation of OHSS, that was fine. And regarding the further management, I would inform the consultant, that was fine. Informing the fertility consultant, that was also fine. But this is a moderate OHSS.
Okay. So we don't need to
So
involve
you
this.
can, no, you are not needed to admit her, and I think you can also because we are not admitting her, so we can also skip the heparin or the Clexin, the blood thinning injections can be skipped. What management needed to do for this patient is obviously you will be giving her painkiller, and in the painkiller, I told you that the nurse here has given the ibuprofen. Ibuprofen is contraindicated with the OHSS.
I just heard that the nurse has already given me the. Okay.
Because with the OHSS, NSAIDs are contraindicated. They are always contraindicated with sepsis and with the OHSS. So the thing is that this patient can have any other painkiller like paracetamol, codeine, but she cannot have the NSAIDs. The painkillers are needed for her at home. Other than that, yes, you will be giving her anti-sickness medication to control the vomiting. Other than that, at the home, you need to do the safety knitting for the patient. Safety knitting, and in the safety knitting, are to tell her the red flag signs. These are also the part of patient safety. Like if she is at the home, she developed worsening of pain in the tummy or pain in the leg, difficulty in the breathing or chest pain, then she needs to report back immediately. Or if the urine color changes or if it decreases a lot, then she needed to report back immediately to the hospital, because obviously it means that the condition is worsening. And yes, you needed to avoid the strenuous activity at home, and you also needed to avoid the unprotected you needed to avoid the sexual activity at home. The reason behind it is that your ovaries are large and they are bulky. And if you go for the strenuous activity or sexual activity and things like this, they can even let the ovaries to twist, which is called as ovarian torsion. That is an emergency. And yes, other than that, obviously, what else we also needed to do her that at home you needed to keep an eye on your urine the amount of the urine you are passing, the color of the urine you are passing, and we advise you to drink the water according to your thirst. Stay hydrated and active at home.
Okay.
Okay. This patient can have, okay, yes. If this patient is saying you that I am unable to tolerate anything which I am taking up, or I am throwing up everything which I am taking up, then she may need admission. But I
Okay.
told you that I have only done the vomiting 2 times.
Mm-hmm.
Okay, so she can be sent home. Let us see what we have in the.
So, what is if it is a moderate OHSS, it is always based on whether the patient or send that to home. So we asked for the admission because patient said yes. So that was the reason because
Yes,
if patient
other than that, the safe place that yes, you can retain the patient for a time being, and you can hydrate her and give her antiemetics, and if the patient feels better, then she can go home.
yeah.
But if she is
And
going home and it's a moderate OHSS, then blood thinning agents won't be needed for the patient.
but at least in moderate OHSS we do prescribe prophylactic vaccine for thinner infections.
Okay, so then someone can please check in the guideline. Let us see, but maybe it has already written in the.
Dr. Ruxana, what you want to ask from the guideline?
That the moderate OHSS, whether we are giving the Clexin or not.
Whether we are?
Giving the Clexin or not.
No. We will individually assess all risk factors. And if no risk factors, only she's having moderate OHSS and she can come on follow-up. Then no need of giving Clexane. However, even with moderate OHSS, if she's like having any red flag, or she's having not able to come on follow-up, then we will admit, and during admission we will give her
Yes.
Clexane.
OHSS has a risk factor of 4, right? But yeah, it is severe OHSS.
But it's a moderate OHSS.
Yeah.
It's a case of moderate OHSS.
Yeah, but
In the severe OHSS, the ovarian size is also above 8 centimeters.
yeah. So,
Pooja, even in severe, we can discuss if she need OPD treatment or inpatient treatment. If she can come on follow-up, the recent OHSS guideline, which is published in 2026, they say that she can come as an OPD patient, even with severe one.
So in that case, we just ask in moderate. My question is whether to ask for the admission or just tell her to for the review follow-ups.
I would suggest you that if the patient is living in an area that where she can come easily for the follow-up after 1 to 2 days, you have been provided the labs which are normal and the ultrasound which is showing clear-cut moderate OHSS. Then it's always better. Our safe play is that you can retain a patient for a while and you can give her antiemetics fluids, and if she feels better, obviously she can go home.
Yeah. Just to tell the practical aspect of this, because I work in UK, so we see this patient on and off. And for moderate OHSS with the symptoms, and if the patient is staying there, we generally patients are offered Clexane. I know the guideline says a different thing, but for prophylaxis for every patient, we do offer Clexane.
Sorry, I couldn't get your question. Can you repeat it for me?
Yeah. So, if I say about regarding the practical aspect of this OHSS, in UK, if the patient comes with this kind of symptoms, with having moderate OHSS, we always prescribe Clexane for the prophylaxis at least for 7 to 10 days.
Well, what I would suggest you that try to stick with the guidelines.
Okay.
rather than going with the practice of the trust, because the key is always set according to the guidelines. The key is never set according to the local trust protocols, I would like to elaborate it here. Like few of the trusts in UK are still offering fetal blood sampling. They are still offering the fetal blood sampling, but in the guideline, they have taken away the fetal blood sampling. Either you can say it that I would like to work, or I would like to take the decision from the consultant and work according to the trust protocols, or you can always try to stick with the guideline. The better way is to stick with the guideline.
Dr. Pooja, I want to explain here. If she if she need to be admitted, then you will give her heparin. In severe
Yeah.
cases, you will give her heparin. Whether you are going to manage even as OPD, you will actually put her on heparin. If it is severe OHSS, or she is having actually any other additional indication of VT risk factors, then you will give her heparin.
So,
And meanwhile, you will give her only stockings, mobilization, and hydration. That's it for moderate OHSS.
yes. So in this case, if as patient agreed for the admission, so in that case, we do offer Flexin or not?
Yes, during admission you will give her.
Yes. Okay.
And
whenever you admit OHSS, then you will give the Clexin.
Okay.
But if it is severe OHSS and if you are not going to admit her, in that case, what you will do?
Of course, we will prescribe prophylactic.
Yes, in severe, because severe is having score of 4, so you will give. Whenever she will stay severe, she will keep this class of severe. She will use heparin. When you will actually reassess her, and she will again you will found that she is now in class 2. I will say in moderate class, then you will actually not give, and even then you will give other type of non-pharmacological interventions like stockings, as I told you earlier, and hydration and mobilization.
Oh.
Dr. Osana, in initial 2 page of this slide having recent OHSS guideline recap. If the
Yes,
audience is interested.
Yes, I was about to bring them. I was thinking that if we can complete the continuity this task, then we can again put the new guidelines.
Okay.
And yes, you can also offer her psychological support.
Okay.
Because they are deferring the embryo transplant, obviously. And yes, regarding the deferring of embryo transplant, you can say that it will worsen your condition. It's better not to have the embryo placement or anything like that. Other than that, you can also bring in that I'm not expert here. The fertility specialist would be the expert, but most likely, keeping in view of your condition, the embryo placement won't be a safe option.
Okay.
Okay, here we also have written down the NSAIDs are inappropriate, and other than that, okay, let me bring it to the top. Here is the information from the new guidelines.
Hello, Dr. Roxana. I want to ask one question, please.
Yes.
According to VT scoring, we score OHSS 4 during first trimester. It's not mentioned there whether it's moderate or severe.
There is a
So
table. Yes.
Just for the table, from the table flow, table of VT scoring, it's score 4.
Yes. There is a table in the OHSS guideline where they have written down the criteria for the moderate, mild, severe, and critical OHSS, and the management that you needed to offer for the mild, moderate, severe, and critical OHSS. In that criteria, they have written down that if it's a moderate OHSS and the ovarian size is less than, I think, 8 centimeter and the laboratory parameters are fine, then you can skip the Clexane if you are managing the patient in the outdoor department.
Okay.
Maria, I will advise you, if she is having main diagnosis of OHSS, you will manage this patient on the recommendation of OHSS. And VT is slightly older guideline. However,
Yes.
the current practice is that you will actually classify the OHSS. And only in
Okay.
severe and in critical you will give, or she is going to be admitted in that case.
In
Okay.
severe cases or inpatient management?
Inpatient management, critical cases, severe cases.
Critical or severe cases.
These are the
Okay.
indications.
Thank you. Mm-hmm.
The table which is given in the guideline, that is a very beautiful table.
Okay, thank you.
And let me to clear, Maria, that table has some other issues as well. In that table, they have written BMI 35, more than 35. But in explanation, they have said it should be 35 or more than 35. So for more explanation, do not follow the table. Follow the actually
New
discussion
guidelines
as
of
well.
HSC.
No. Even in the VT, you will get the idea of this, that in severe cases and in inpatient care, you will give. So
Okay.
actually, table cannot actually explain everything.
Okay. Got it now.
Score 4 is for pregnancy. Once patient is pregnant, if there was a late OHSS or in OHSS if she is pregnant, then it is considered as score 4. And she is not pregnant here. So in that case, I think we just stick to moderate and severe for differentiation.
Okay, so who is going to do the next task, and what is the next task that we're supposed to do?
I'll be doing it. That's for 43 years old for infertility counseling.
Okay, let me share it.
Okay. Pooja, if you have any query relevant to your actually topic, you can inbox me.